Hi everyone, I'm Whitley Senior and I am a mental health practitioner in CAHMS and a drama therapist by background. So before the People Hub, I'm a drama therapist and I came to that role by my drama degree. I had that whole ambition of I want to be an actress, let's see how that goes, drama school and everything. And then I was introduced to drama therapy in my second year. And I thought, what in the world is drama therapy? Like some people might be thinking now. And because I'd done support work in the past and I wanted to do something that combined creativity and supporting people, but I had no idea that drama therapy existed. So if anything, it really opened my eyes. And then I did a 2-year MA, trained as a drama therapist, graduated in 2017. And I have been practicing for nearly 5 years with mostly children and young people with social, emotional, mental health issues, trauma and attachment, disability, physical illness, different types of history, and I've absolutely loved it. So I think part of me has always been a little bit avoidant of the NHS, and it's not because I don't respect the NHS or haven't had experiences. I'm actually a patient myself. I have a long-term illness, so I've had excellent, exceptional service. I think as a professional, I guess my self-worth, I didn't think maybe I was good enough. So I did struggle with maybe applying for jobs and kind of maybe going for that route in the NHS. And so the People Hub, I guess, maybe gently introduced me. So the ICS has really helped me feel more comfortable as a professional, especially in the NHS. I guess I just didn't have the self-belief in myself to really go for a role in CAHMS especially. I didn't think I was good enough, but I am assured that I am. And I genuinely feel like I now have a career within the NHS. I do other little bits of work on the side, but I feel the NHS is now a home for me. My highlights are being introduced to the ICS, the People Hub, but then finding new and innovative ways of working. But it's been nice to have an MDT. It's been lovely to be in office with different professionals, trying to borrow each other's techniques from a toolbox, and utilise one another. Just be a team together, because that's something I missed. And I didn't have very many team meetings because the companies that I did work for were dotted around the country, not in area. So that's one of my highlights, the team and the team spirit and the fun that we have, the camaraderie, but also the patients. Honestly, I love what I do and I do it for them. Maybe my empathy has increased since becoming a patient myself, my compassion, but I genuinely care for those I work with and I want to do the absolute best for them. So my typical day, it involves meeting patients and their families, overseeing their treatment, ensuring that their needs are fulfilled, so working systemically with everyone involved with their care. It also is a lot of paperwork, recording clinical notes, which is part of the process, meeting legislation for audit purposes, and recording outcomes, how they're doing their progress. And it's also working as a team, ensuring that we're helping one another, getting the job done. And yeah, every day is different. I can't say that it's the same every day. It's just, it can be crazy, up, down, round and round, but I absolutely love it. Okay, my aspirations for the future. Hold on, let me get my really long list. No, genuinely, I am a big believer in if you want something, you can have it. It's about self-belief, genuinely. And it's taken me a while to get to this point, but I'd say work is a work in progress. It is. And every day is different. It's just being open to change. So my aspirations are to become a clinical supervisor, because I'm a therapist and I've got a few years of experience. I'd now like to be a supervisor for therapists, and being a black woman as well. I want to be, I'm a black therapist in a, I guess, a largely white-dominated profession, and so that's really important to me. And being a black supervisor and being able to offer a space where maybe it's just more variety and maybe different approaches. I've just published an article, in the Drama Therapy Journal, which is about race, so I'd like to continue writing. I don't know what the future holds, but I'm just really eager to continue supporting children, families, patients, my team, and myself. Yeah, so